Hi, and welcome to the Neurology Nook, where we dive deep into different topics of neurology, covering everything from Alzheimer's and stroke to the latest breakthroughs in research and technology. Hear inspiring patient stories, gain insight from top neurologists, and discover, most importantly, how to keep your own brain healthy. Madison Levine, welcome to the podcast. Thank you so much for coming on today. Just for our guests, would you give us a little bit of an intro on who you are and what it is that you do?
Absolutely. Thank you for having me. I appreciate it.
Of
Um,
course.
my name's Madison Levine. I founded an audiology clinic in Charlotte 10 years ago in 2015,
Mhm.
and I was really following in my mom's footsteps. She had a clinic when I was growing up for more than 30 years, and I saw the impact that she had on people's lives, helping them connect with loved ones, and I ended up deciding that's what I wanted to do too.
Oh, wow. Keeping it in the family. I love that story. That must have really made an impact on you to see your mom do that. And was she running her own business all this time too?
Yes.
Oh, good for her. What a
I
wonderful example you had.
I was very lucky to have her mentorship as a clinician, but also as a business owner, because it's a
Sure.
completely different skill set.
Oh, yes, absolutely. And we have definitely learned that down the line as well. Well, I really enjoyed listening to your TED Talk, and we can go into that a little bit more. How did you even get to do a TED Talk? That's really neat.
It was way off on my list of wishes for years from now. It wasn't something I had set a goal for this year. And
Yeah,
I am pretty particular about setting my goals at the beginning of the year and accomplishing that. Um,
sure.
but this was just out of left field. I had a good friend who she pursued the rights to put on the TED Talk.
Oh, wow.
And she reached out to me directly and said, "Hey, I really want you to apply. You need to do it by this weekend."
And you're
So,
like, "Oh, okay. Let me pause my life and crank this out."
what's your big
How
idea going to be? Yeah.
Yeah.
how was the experience when you got acceptance?
Oh my gosh. Well, I was surprised, first of all, because I filmed the video for my application at midnight in the dark with the lights on, and I just threw it together, and then they didn't do callbacks. And so I thought that I'd missed the opportunity
Oh,
get called back by that Friday. And I talked to my business coach and I just said, I'm working through it. It's okay. I didn't get it.
yeah.
Now I actually won it. So now I'm going to apply next year. And the next week she reached out and said, "Oh, actually, we didn't even do callbacks. We just made the cut and you're in."
Wow.
Wow.
Oh, man, what an exciting moment that must have been.
It definitely was. I didn't really know what I was in for. It was a big commitment.
Oh, I'm sure. Yes, and it's people really love and trust TED Talk as well, so you know that you're getting an incredible, a global audience when you're on something like this. So I'm sure that the pressure of that was sitting with you while you were preparing and while you were on the show.
Yes, because it's going to live on for many years. So I had really high expectations of myself. And what I wanted to do was create a piece of content that would go way farther than the Charlotte community, that would
Mhm.
have impact, hopefully, across the profession and a ripple effect, I hope, across other healthcare professionals who can look to it and go, "Oh, wow, this is a piece of the puzzle that maybe has been compartmentalized, but
Right.
we can fit it into a comprehensive look of at how to help patients age better."
Absolutely. I love that. Now, your TED Talk spoke specifically to me. I have a beloved family member who suffers from cognitive impairment. And listening to your description of maybe not overt hearing loss, especially on a one on one basis, but this sort of confusion and effort that they have to put into listening when there's any other competing noise, I have noticed. And so already this morning, I am jonesing to get this person in to be seen by audiology. So you certainly had an impact on my story in that way. So thank you. Sort of
Right.
from that level, what do you think is the most important thing for us to know about what you do?
Yeah. In that talk, I referenced high frequency hearing loss.
Mhm.
And if there's one thing that I wish more people knew about coming in to get screened for hearing issues, it's not that things always get quieter. it's not always obvious to the person who has the hearing loss that they actually have an issue. It's very common for them to reflect outwardly and to think, well, why aren't they coming in the room to talk to me? And if the TV wasn't on, I would have understood you.
Mhm.
And nobody can hear in restaurants these days.
Right.
There are these external things that it's very easy to blame, and I don't blame them. That's what our brain does.
It's
But
adjusting and coping.
the reality is when they come in and we check them, we find a high frequency loss oftentimes, which means they hear one-on-one perfectly fine, no issues. When they're in those other circumstances, it's like they have holes in their hearing. So it may not show up the way that people expect.
Mm, that
Bef-
makes
So
sense.
before we go into more details, can you give a brief, like very superficial overview of what hearing loss is and what do you mean by high frequency versus low frequency?
Thank you. Thank you for taking me back a step. That's a good idea. Um, so if you imagine a whole piano keyboard in front of you, I think that most of us imagine that if we're losing our hearing, that whole piano keyboard, we're just going to hear it all dimmer. It'll all just be quieter. But the reality is, for most people, we just start losing certain notes, not all of the notes. And what's really fascinating is if you take the alphabet and you scatter it down that piano keyboard, different letters align with different notes.
Mm.
So you might hear some letters perfectly well and other letters not as well. And this is why people have trouble with clarity. They're going, gosh, I heard you, but it just wasn't clear. Can you repeat that?
Mm.
That's a really good analogy. Actually, the in the cochlea, which is the sense organ for hearing, has arrangement similar to piano, with starts with lower frequency, and as it goes farther, the frequency goes higher. So that's a really good analogy.
Thank you. That's the way I describe it to my patients. And, like you guys, I'm sure you've spent tens of thousands of hours helping people and trying to explain things, and you start realizing what works and what
Yes.
doesn't. Yeah.
So who are these high risk population that are at risk of this high frequency hearing loss?
Yeah. So, one, there certainly is an age factor. So, when we get over 65, we're really starting to see a drop. When we get to 70, it's every other person. But if you look around, every other 70-year-old is not wearing hearing aids.
Yeah.
Yeah. Part of it is not being aware.
Mhm.
There's also a cost factor,
Mm.
access to care. There's many reasons. But the other thing is noise exposure. So that also can really hurt specifically high frequency hearing.
Mm.
I saw a gentleman yesterday who has worked for an airline for his entire career. And even though he's used hearing protection, basically his hearing across the low frequencies was perfect. His hearing across the high frequencies was a severe hearing loss. And for him, it meant he could hear one-on-one with no problem. But if his wife he tried to talk to him from the next room, it did not work. And
Sure.
he thought it was her and then prove that it was her. And I had to address, the facts that we actually had a big, big loss there.
Oh, goodness.
If you misunderstand what your wife says, then that can be a problem as well.
And God
Spouses are good for calling out these little things,
Yeah.
Yeah, that's really great information. And it sounds like a lot of this could be fixed with simple hearing aids. Is that right?
Yeah. So what we're talking about here with these high frequency losses, it's the most common type I see in my office. And 95% of the time, this is going to be a sensory neural hearing loss,
Mm.
which means it's in the cochlea, like you said. And right now, we have no pill, we have no surgery. Hearing aids are really the solution for that.
That
Until
makes sense.
someone falls past the point of hearing aids helping, and then they might get to a point where a cochlear implant can work.
Mm.
That's way past the majority of people we're seeing.
That makes
Okay.
sense.
Now, recently, in last few years, we have seen this explosive growth of AirPods. And what do you think what's going to happen to this generation of people who are used to listening AirPods at high volume for decades to come?
I bet we're all thinking the same thing. And I am in agreement. You know, having that much volume right in your ear, it's dangerous. And if we look at OSHA that goes into businesses and it gives us controls on how much volume is acceptable, it's really not just about volume, it's about duration.
Mm,
So if we hear a really loud concert for a couple of hours, that might be dangerous. But if we lower the volume, we might can listen for 4 hours or 6 hours. So I don't have an issue with AirPods being used at a safe volume. You can listen all day.
mhm,
But when it's too loud, we're just hammering those high frequency hair cells.
mm.
So what would be considered a safe volume? Sometimes your phone shows like how many decibels is
Yes.
in the environment. So what would be the safe level?
That's always going off for me, especially during bath time with my kids. Everybody's screaming and splashing. It's like, it's too loud in here. I'm like, I know. There's nothing I can do.
You know, there are apps that you can get on your phone that will keep you within safe limits, which is great. And there are some settings within Apple now where you can go into the settings and you can limit it.
Mm,
But if we were to look up OSHA's ratings, 100 decibels, you can imagine, is very loud.
yeah.
You could be at a concert that's 100 to 120. That's very dangerous. We really want to stay well below 80
Mm,
if we're listening to music ourselves. I would say 60 to 70 is a good, strong volume that is not going to be putting you in the way of harm.
mm. Okay, that's a good recommendation. And that's something that most people can track on their phones. I think the AirPod actually has a thing where you can set a limit. Maybe most headphones do now, Bluetooth headphones, where it won't let you go over that limit. So that could be something worth looking into if we're not sure what that sounds like. I'm not. I know I'm not.
You can go by your own gauge too. We kind of know when we're over the limit, when we're rocking out a little bit too hard, and we need to
Yeah,
back off just a little, turn it up for that one song and then go back down.
sure. That makes sense. That seems like a good way to do it. Now, I know that you talked a little bit more too, especially in your TED Talk, and of course, as neurologists and neurology PA, we're interested in this as well. The link between hearing loss and dementia. Can you talk a little bit more about that?
Yeah. There have been a lot of studies in recent years, and they all are really supporting the same result, which is that we want to keep people involved and communicating clearly because it keeps their brain stimulated. And it also helps with that confusion and listening effort, like you mentioned earlier. I'll give you an example of something that happened really early in my career that was very impactful for me.
Mm,
I had an elderly woman in her 80s who was brought into my office. Her daughter had brought her in. I
mhm.
went to greet them. The daughter kind of snapped at me and said, "Don't even talk directly to my mom. She's not going to understand you. She has dementia. Just talk to me."
Oh,
And, my perspective is I want to give respect to the patient,
mhm.
and I always try to speak directly to them. Even if I end up having to have involvement from a significant other, I want for them to feel like
The
I'm there with
dignity, yeah, and the
dignity.
connection.
That's the word. And so I did. I tried to make every effort to really communicate directly with this elderly woman. It was very hard.
Mm,
I ended up testing her hearing that day. She had a severe hearing loss across the board. There was
mhm,
no way that she could have been communicating clearly with me.
mhm.
Um, she had never had hearing aids before. I was able to put on a pair right there in the office, and she could answer my questions quickly,
Wow.
easily. It's not to say that she might not have had dementia, but it is to say that there are a lot of people out there who are missing things, who come downstairs at the wrong time. They thought you said 9, you said 5. You see how that rhymes?
Mhm.
They're misunderstanding. And when it goes on a long time, you've got to imagine how much stress is that putting on their brain.
Sure. And it sounds like an open door for misdiagnosis, especially by the family. Like even in this case, perhaps her dementia wasn't bad.
Mhm.
Perhaps it was mostly a hearing loss issue. It makes me think that for all these patients that we suspect to have dementia, they should all have hearing evaluations, even first as part of the workup.
Just be part of a screening process. I have a colleague who's very involved in senior living facilities,
Mm-hmm.
and she has shared with me that it's very common for cognitive screenings to be run on patients because that's part of the intake. But the hearing screening is not across the board. You've got tons of cognitive screenings. People are passing, failing, and they really have no idea if the patient was even hearing the questions in the first place.
Oh.
Absolutely. Wow, that's a serious confounder in the mix.
Is there anything available commercially that people can use to test their hearing? For example, some kind of app on the phone with headphones or AirPods or something that can assess your hearing. Not a full hearing evaluation, but at least some basic screen.
Yes, there are tons of them. And I don't have one in particular to recommend. AirPods now have their own tests through them, but there are many free apps where you can screen your hearing. And a lot of them, what they do is instead of testing really the whole piano,
Mhm.
they'll test maybe 4 pitches across the piano.
Mm.
And what you'll see is maybe people will pass 3 out of the 4. That fourth one might be a high frequency loss. If they're not in the normal range, by all means, that's a great screener at home to say, okay, I'm going to go get a professional test. Let me see where I really sit.
That's
Yeah.
great that that's so widely available. Yeah.
Yeah, so for the listeners, it's easy screen, and if there is any hearing loss detected, you can get diagnosed early on. I remember back when I was in neurology residency, like more than a decade ago, there was not that much emphasis on hearing loss as one of the causes of dementia. It was probably at the bottom. It was known, but it was not emphasized. So there was a big list of causes or contributing factors to cognitive impairment in elderly. The hearing loss was at the bottom, and now we have seen recent recommendations that hearing loss has been like one of the top
Mm.
contributors for mild cognitive impairment and progression of dementia.
Oh, that's good that we've seen that change happen. Yeah.
Yeah, it has risen on the list. I do still see a lot of people, they reference, moving our bodies, being physically active, checking in with your cardiologist, eating healthy, doing brain puzzles, those kinds of
Mhm.
things. But of the screeners that we can do to help reduce our risk, getting a hearing screening is really simple way to
Mm.
say, well, let me just eliminate that one. One of the recent studies that I referenced in that TED Talk was published in the Journal of the American Medical Association just in June of this year. And this kind of blew my mind the way that they phrased it. They said that up to 32% of dementia cases could be attributed to untreated hearing loss. And that's a different way of looking at it than many of the other studies that are going, okay, this is one of the
Contributors.
contributors.
Yeah.
Exactly. And you guys can speak much more to this, but of the cases of dementia out there, we've learned that the vast majority actually have modifiable risk factors and you're impacted by your environment, not just your genetics. You're not just born to have dementia.
Right.
Absolutely. So many more environmental factors are being unearthed that people have not thought of in terms of preventing risk of Alzheimer's, dementia of all types. So it's exciting to see this come out. I wonder if we can start to reverse this trajectory, this rise that we're seeing in dementia and Alzheimer's, and turn things around as we raise awareness about what it means to actually be healthy, what kind of environments we need to put ourselves in, what kind of things we can do to actually change our genes through epigenetics to make ourselves and our future kids healthier as well. And then certainly these essential screenings to try to prevent Alzheimer's and dementia down the lines. This is a big deal.
So now moving to the next step, say if someone is concerned about hearing loss or their family member is concerned about the hearing loss, what kind of hearing tests you do that can confirm the diagnosis and give you the degree of hearing loss, and what that test entails?
Yeah. So anybody who's had maybe a screening while they're in school, they can remember the raise your hand if you hear the beep kind of
Hmm.
test, right? And a lot of times people will say things to me and they just did a beep test. Who cares about hearing beeps?
Yeah.
But the reality is those beeps line up with those notes on the piano keyboard. So again, they line up with different letters of the alphabet. So it actually is a very important test for us to test those different tones. So that's required across the board for anybody licensed in any state. You're going to have what you call a pure tone test.
Hmm.
But if you take it a step or two further, not required, but I think it's very important. One, to do speech testing in quiet to see how you understand words. Can you identify clearly what word you heard? And I really prefer that that's done with a recording at a specific volume, not a live voice where somebody's saying the word and, it might be different today than it is tomorrow, depending on their
Sure.
voice.
Sure.
It's not something
So testing in
standardized.
quiet. And then the last is speech and noise.
Hmm.
We get an entirely different picture of what's really going on in the auditory system when we look at how you're able to differentiate between speech and the noise around you.
Mm, that makes sense. Actually, that was just added to the essential testing that all of our patients get at the audiology service that we work with. They wanted speech and noise and a comprehensive hearing evaluation for every patient that comes in. So I'm glad to hear you really support the essentialness,
Yeah,
how essential that is.
it really is. And it also can raise other flags for us. So, what if somebody has completely normal scores for their tones,
Hmm.
their speech and quiet, but they can't hear speech and noise?
Mm.
So, in theory, if only that first or second test were performed, you'd say your hearing's normal. But when you do that third test, you're able to identify things like auditory processing disorder,
Mm.
which can have wonderful treatments. If they get into the right therapy, they can start to differentiate words and noise.
Wow. So does that just test high frequency hearing loss, or is that something kind of completely different? You said auditory processing.
Yeah, it's across the board. It's not just high frequency. So, auditory processing disorder has been known for a long time, but there was a high focus on children and
Uh,
not at all on adults. We've come to find out that, even with age related hearing loss, people can have a processing disorder with how their brain is trying to distinguish that speech.
oh, wow. And how would that present?
So, for example, I've had a couple family members who actually have experienced this.
Oh, wow.
You might have somebody who is young, maybe they're in their 40s. They don't have any history of loud noise exposure,
Mm.
but every cocktail party they can't understand. So they finally come in, they get tested. Their first two tests are completely normal.
Mhm.
So in most clinics, they would just get sent home. Do the third one, you realize, no, they have a processing disorder with how that sound is being perceived. It scrambles when background noise is present.
Wow.
And so they can see a specialist in APD and they can go through steps of therapy, which might be anywhere from 6 to 12 weeks of therapy. It's like going to PT.
Yeah. For your brain. Wow.
Teach their brain how to understand those letters through the noise. And it's highly effective.
Wow. That's really incredible that there is a treatment for that. You would think that was one of the diagnoses and audioses that we hate in neurology, but knowing there's a specific therapist for that, I mean, that's a lot of hope for a lot of people.
It is. It is. And there's not a lot of them. You can Google auditory processing disorder. There's a great website that'll let people find specialists.
Mm.
There may only be one in your city.
Oh, wow.
It's very specialized.
That makes sense. I could imagine. Yeah.
Now, once you diagnose high frequency hearing loss or in general, any kind of sensory neural hearing loss, what kind of treatment options you have? Do you have hearing aids or any other therapies to improve that?
So we start with hearing aids because that's the first thing is we've got to get the sound equalized to a
Mhm.
point where patients can hear the sounds appropriately. After that, we can do something called oral rehabilitation, AURAL, oral,
Mhm.
like your ear,
Oral.
your mouth.
Yes.
Hard to for that to come through on a podcast.
Yes, it definitely is.
But oral rehab is similar to that APD rehab in that it's helping brains to distinguish words.
Mm.
So the first step is always going to be correcting with the hearing aids. And then we can also do therapies after that as well.
That makes sense. Now, I can't believe the tech behind some of these hearing aids these days. I have an uncle that has hearing aids, and to a wedding we went to recently, he brought an amplifier that he put in the middle of the reception table that we were eating at, and he could hear everyone. And he even says that sometimes he forgets that he left it there and he'll go to the bathroom and he can still hear what everybody's saying at the table. I thought this is a great like FBI tool, actually. Maybe we should use it for spying on other countries.
Superhuman. hearing.
Yeah, exactly.
I've heard some stories about it being
Sure.
used in some sneaky ways.
Oh man.
Uh,
Check on your kids, like leave it in their room.
Now,
Oh
now
man.
these new earphones, these wireless earphones of new generation, can they replace hearing aid at least temporary basis?
They're a great start. So even an AirPod now can pull up some high frequency sound.
Mm,
So you can make some corrections with a lot of these different Bluetooth devices that people are wearing. I think that it is hopefully lowering the age of people getting help.
mhm.
Because right now, my average patient is 71. I see 18 and older. I had a 40-year-old in the office this week. I see all ages, but it
Mhm.
skews older. It takes 7 years on average after someone has identified a hearing issue before they get hearing aids.
Oh wow.
It's a really long time. That wouldn't happen with glasses or
No.
so what we're hoping is that as we do a look back over the last couple of years, now that there are some over-the-counter options, that 7 years will get shortened. I hope that people are willing to use those and try them out at year 1, year 2, year 3, but we still are gonna have a graduation point for most people where
Mhm.
they do need a more prescriptive device. Like you said, the tech has gotten so smart in a prescription device. In a over-the-counter, you're gonna get good basics,
Mhm.
but it's not gonna be able to tackle background noise for you. It's not gonna have good compression built in for loud sounds to make them comfortable. And it's also not going to have features like now we can really address a lot with tinnitus through hearing aid.
Oh wow, really? Even tinnitus. That's so interesting. We have a lot of patients, as I'm sure you can imagine, we see a lot of concussion. We have a lot of patients with tinnitus. Luckily for most, it self-resolves, but for some, it does stick around quite a while.
I'm so glad you mentioned that because a lot of people just assume that tinnitus is with you for life. In some cases, it can be, but
Mm.
there are acute cases where it comes and goes.
Do you still recommend hearing aids for more intermittent tinnitus?
I wouldn't. I wouldn't.
Mhm.
I'm sure I do a lot of what you guys do, where we look first if there's been an event like a concussion,
Yes.
of course. We look at medications. Because as we know, the list of side effects can be long and they basically throw tinnitus on every list because they're not sure.
Yeah.
But in particular, pain medications can bring it up. And then anything that is really stressing the nervous system, from caffeine to alcohol to lack of sleep, can create tinnitus or exacerbate it.
Really?
Very
Yeah.
much so. And so anything we do to calm the nervous system can calm the tinnitus. So first I look at those factors with people. This is crazy, but 90% of people with tinnitus
Mhm.
have a hearing loss.
Oh,
The
wow.
vast majority have got damage to those hair cells. They're not hearing well, but they're also misfiring and sending a sound that they shouldn't be sending.
Oh, wow. So a lot of times they come in concert together.
Often. So we see tinnitus many times a day in our.
I'm sure.
There's a
I'm
big
sure.
overlap. Yeah.
Yes. I didn't know what you said about the opioids being linked to tinnitus as well. Are there any other medications out there that you can name that are linked to tinnitus?
Those in particular, those are the
Mm.
highest.
It reminds me of one of the patients that I saw like so many years ago in the emergency room. Patient came at night, like late night, with acute onset tinnitus.
Mm.
And we went through the medication list, and he was just on usual medications, including aspirin. And then we went into the details of how much of these medications he was taking. And he was taking tons and tons of aspirin for joint pain. And we checked the salicylate levels in blood, and apparently he was having salicylic acid poisoning from that, and that
Oh, wow.
that was causing tinnitus.
Oh, my goodness. Well,
Um,
add that to the list. That's terrible.
I know, gosh, the things. And a lot of people are on a low dose aspirin, and I'm sure you guys say this on the podcast all the time. Don't stop what you're doing. Go talk to your doctor. But when a new medication has been started
Hmm.
and tinnitus has come along in the next days or weeks, a lot of times you need to go back and talk to your doctor about it because it might have been a
Yeah.
side effect.
Yeah, that absolutely makes sense. That's definitely a good tip for our listeners. How much tinnitus would you say is normal? Because I feel like a lot of people will have maybe an episode of ringing in their ear like once every 2 or 3 weeks. Is that something we should be worried about?
Tell you, those more acute cases where it comes and goes, it probably has more of a lifestyle factor than anything else.
Mm.
When we have tinnitus that is chronic, now we're looking at something that is probably connected to the auditory system.
So it has to be more frequent than once every 3 weeks for sure.
Yeah, in those, I wouldn't be worried too. I can say in a lot of cases with tinnitus, people are stressed. When they first start really identifying it, they think, do I have a brain tumor? They kind
Yeah.
of go to a worst case scenario. And so I think it can be really calming for them to know 50 million Americans have some form of tinnitus, whether it comes and
Right.
goes or it's chronic. In rare cases, would it actually be indicative of something bad? Most of us have it, and it's just something that we deal with.
Sure. That's good to know. Lifestyle, right? Everything always comes right back to a good lifestyle, stress management, trying to, eat healthy and exercise as a good basis and as a good starting point. But I'm glad that especially with all the technology and hearing aids and testing that we have, we can add a little bit more of a scaffolding for these hearing problems too.
Going back to the hearing aids and the people not using it that much, what are the prohibitive factors? Is cost one of them?
Cost is absolutely a factor. An unidentified problem is the number one reason that people don't get help. Number two is probably cost. So hearing aids today are anywhere from, you can have things that call themselves hearing aids that are $100
Yeah.
up to even $10,000 for
Oh,
a pair of hearing aids. One of the things that happened a couple years ago is over-the-counter hearing aids made a bunch of news. It was a big push to add accessibility for people, and it has done that. So we now have devices that are in Walmart, in Walgreens, that are anywhere from $100 to maybe $600. What happened though is that it didn't really put hearing aids into that category.
hmm,
It allowed products that are basically just amplifiers to label themselves as hearing aids. So it was with the best intentions, but it hasn't really made that much of an impact. And so back to cost, true quality hearing aids, you've got a big range depending on what the person needs, but I like to say anywhere between 2 and 8,000 a pair is where you're going to find things depending on how much care is wrapped up in it and what the technology holds.
wow. And is this ever covered by insurance? Okay, good.
It can be. I had somebody yesterday who had $2,500 towards hearing aids. Last week, somebody had $5,000 towards hearing aids.
Oh,
It
wow.
just depends on the policy. I would say the majority don't have hearing aids included, just like eyes and teeth are generally not included.
Including the Medicare and Medicare Advantage plans?
Yeah, so Medicare specifically excludes hearing aids, and it has since its inception. So
Wow, what an interesting choice for a very specific population that actually needs hearing aids.
they'll pay for a test, but not for the treatment. There are supplements that absolutely help. And now there are Medicare Advantage plans that they don't really have benefits. They have a discount program. I'll get on my high horse.
Yeah, do it.
I'm sure y'all are frustrated with insurance too. This is one of my big frustrations is they will sell to the patient that the Advantage plan is going to get them hearing aids highly discounted.
Hmm.
I have accepted them in the past and I've had to go out and network with them because the reality is they discount the units up front. They pay the provider so little it doesn't even account for their time. So then the provider has to charge the patient for every single minute thereafter. The
Mm.
patient still ends up paying out of pocket for the whole thing, but it looked like a discount up front. So that's frustrating. But I want to say one more thing about cost. The NHS, so in the UK, they give away hearing aids for free. However, people are still not getting them at the rate you think they would. So in the US, about 20% of people who need hearing aids have actually gotten them. In the UK, it's at about 40%. So that's great. That's double. But what about the other 60%? Why aren't they getting them if they're
Yes.
free? It goes back to that point that cost is not the number one factor. Number one is that they either haven't identified the problem or maybe they don't want to.
Yeah, that makes sense. Or maybe it's being confused as something else.
Social stigma associated with the hearing aids
Mm.
sometimes.
Yeah, there can be. And I think in a younger generation, we're used to seeing AirPods in ears. And if you're just wearing a device and it's fixing your hearing while you're also listening to music, you would hear.
Yeah. Luckily, a lot is being destigmatized as the generations go down with that kind of thing. Mental health, hearing aids, all kinds of stuff.
Yes, mental
What
health.
about cochlear implants? Can they be replacement of hearing aids in some specific situations? What is their indication and what would be the cost?
Yeah. Cochlear implants have come so far. They're very effective. I don't know if you guys have heard of the movie The Sound of Metal.
No, I don't think I have.
No,
Have you?
me neither.
It made a big splash. It was about someone who got a cochlear implant, and it was basically the worst case scenario. It made it look like the
Terrible.
biggest failure and so scary. And I'm afraid that people seen stuff like that and they assume that a cochlear implant is going to make everything sound fake and metallic and
I'm glad I didn't watch.
No, we don't have to be scared of that. Oh no. Don't watch it, listeners.
But I think that 20, 30 years ago, the failure rate for a cochlear implant was high enough that people really had to stop and think about whether it was worth it. Now they're so successful. We have incredible surgeons in Charlotte. They're doing at least 200 cochlear implants per year, which is a lot. The thing about a cochlear implant is that it's not invisible.
Hmm.
It's not like going in and getting cataract surgery and no one sees that you had it done. You actually end up wearing a device that is a little larger than a hearing aid would be.
Hmm.
It's just directly attached into the inner ear. So you've got a magnet on the outside of the head where the cochlea is. And then you also wear a device generally over the ear that looks like a hearing aid. So when we get to recommending a cochlear implant, it's because we've passed the point that hearing aids can effectively fit that hearing loss. So when it's
Mhm.
bad enough, hearing aids aren't helping enough, you cross over and you can get a cochlear implant. So I think a lot of people assume, why can't I just get an implant so no one can see it and it'll fix it? We
And
are
you're like, no,
aren't
it's on
there
your
yet.
head still. Yeah, absolutely. Well, thank you so much for coming on our podcast. As we sort of wrap up here, can you tell our listeners what are the biggest takeaways that you want them to bring home with them today?
If I could ask one thing of the listeners, it would be to think about someone in your life who might seem to be missing some of the conversation, doesn't seem quite as with it as they used to be. What I would love is for them to recommend that that person get a hearing test
Mhm.
because it could just be hearing. It could be fixed so easily. And until you get tested, you really don't know.
Absolutely. It seems really low risk, high reward to investigate.
Thank you guys so much for having me.
Thank you for coming. It's been such a treat. We really appreciate your time and your valuable information to our listeners. So thank you again. I'm sure we want to have you back on again next time.
I would love that. Okay.
And to our listeners, thank you so much for plugging into the Neurology Nook today. We'll see you next time.